Joining us now to talk Medicaid, vaccines, AI, and more, CMS Administrator Dr. Mehmet Oz. Dr. Oz, Mehmet, good to see you. Good to have you on this morning.
Good morning, Joe.
We have been using a phrase a lot lately, and I'm talking about in terms of the reconciliation bill, and that don't let the perfect be the enemy of the good. Everybody's talking about Ronald Reagan, who used to say, if I can get 80% of what I want, I'm ready to accept that and negotiate. Did you get 80% of what you think was needed in terms of Medicaid reform in that House bill yesterday, Doctor?
I think we did, Joe, and I'll tell you that for everyone listening, this is really important. The major goal in Medicaid is to align the federal government with the states. You want the governors doing the same thing for the same reasons as the federal government is doing those same things to help our most vulnerable. In the building that I work in, which is the Hubert Humphrey building, it's where Bobby Kennedy, myself, and some of the other agencies are based. There's a little placard on the side that Hubert Humphrey had said back in the day when the building was being built. He said the moral obligation of government is to take care of folks who are in the dawn of their life, the kids. I'll come back to them with the MAHA report yesterday. Taking care of those in the twilight of their life, the seniors, that's the Medicare population, and then take care of those living in the shadows. So I think we're doing that. But we have a malaligned system where governors often are wisely gaming this system to maximize revenue for their states. But it hurts the federal government, it hurts the taxpayers, and it actually creates an incentive for people not to participate in life. That's why these work requirements, which was the most important thing that the House pushed forward, are so critical. And here's the key question, because it gets argued politically all the time. It's very simple. If you're going to get free food on a SNAP program, you have a work requirement. It's an obligation to try to work. You might not get a job, but you got to try. In Medicaid, we're saying try to get a job or volunteer, take care of someone in your family, go get an education, do something that shows you have agency in your life, that you want to make a difference, the fact that you matter. And when you don't ask that of people, you end up with generational poverty. And I've spoken to governors who, in a quiet moment, will admit that there are people in their state who will not work because they have never worked, because their parents didn't work. They don't know what it feels like to have that sense of accomplishment. And we need to change that both for the emotional well-being of our people, but it also is a budget breaker if we don't.
Did it go far enough to try to balance out? You've heard how many times, Doctor, about it? It disproportionately benefits working age individuals versus disabled people and pregnant women. They get 7, 8, 9 times the reimbursement. And I think that's what you're referring to with the governors. Does the work requirements solve that? Because yesterday we had a gentleman on that said, well, we're trying to make it so Texas and Florida don't go the route of a lot of these other states in gaming. Not doing anything about the states that are already gaming the system, but just trying to prevent more states from actually gaming the system.
Well, there are hundreds of billions of dollars of saving that we're estimating, $770 billion in particular for just getting some of these different changes through there. But the work requirement is a big part of that. And as I mentioned, it has a moral benefit as well as a financial benefit. But the fundamental disconnect, which you're touching on, what I want to clarify, is that a able-bodied individual with no kid actually reimburses better than a pregnant woman with a kid who is disabled. I'll say that again. The original Medicaid population, the young, the elderly who don't have money, a disabled child, they actually are less valuable to the healthcare system than an able-bodied individual who is hopefully going to get a job and move on. And that happened because of this bizarre path that we chose when we expanded Medicaid in 40 of the 50 states that actually reimburses higher. We pay 90% of the bill. So the states say, well, if you're going to pay the whole bill, we're going to just throw money at this problem and try to get as much cash into the coffers of our hospitals and other social services in our state. But it takes away the responsibility and to actually manage who you're taking care of. And in some states, California is an example where illegal immigrants get Medicaid coverage. There'll often be slippage, and the federal government ends up paying for that. What that really means, Joe, is someone in Mississippi is paying tax dollars so that illegal immigrants benefit in California. Now, if we as a country decide to do that, that's one thing. But now we have every state pulling the oars in a different direction, and it creates the morass that is unhealthy for our system.
Is it fixed in this bill? And when the president said don't F with Medicaid, did that make it more difficult to do what's necessary? Because once again, we're thinking about an election in 2 years for a lot of members of the House.
the president was powerfully protecting Medicaid, which he has said over and over again. He's going to love and cherish these programs. He doesn't want changes to Medicaid and Medicare, which are vitally important. There are 68 million people on Medicare. There's almost 80 million on Medicaid and CHIP, children's health insurance. He doesn't want those hurting the vulnerable populations. That is a moral hazard.
Yeah. They got to be fixed. Are they fixed now with the House bill, or does the Senate need to do more? They're talking about doing more.
Well, we have fixed the short-term budget issue. The Senate very wisely is considering whether to make structural changes to address the problem we touched on earlier. How do you get governors to want to do the exact same thing that the federal government wants? And there are some changes that will be wise for this system. Our goal, as you know, is we've got a bunch of people in different roles in the cabinet that the president has wisely appointed to make a difference. My purpose in coming into government was not to serve for a couple of years, patch up a few things on the edges and move on. It's to make deep seismic shifts so the system is healthier going forward. This is true for Medicaid, Medicare, and all the social programs for health insurance in America.
If you want to talk Maha, and I have said many times, Doctor, that we have Roger Altman on, who had a heart transplant, and not everybody knows it. He wanted one surgeon to do that heart transplant, and that was you. So you're a lot more than a TV star, obviously. Anything that the Secretary Kennedy says where you go, as a doctor, where you go, I'm not comfortable with some of the conjecture or vaccine stuff. Were you on board with everything that Robert F. said yesterday at the White House?
The Maha report that Secretary Kennedy drove through together with Secretary Collins. And of course, the president made it possible because you had everybody represented. There's one goal. It's the same thing every parent always says about what's going on in their children's lives. I want to double check to make sure everything's okay. That's what Secretary Kennedy is arguing for. We have to go back and look at what the hard science really says about many things we've taken for granted. And this is a fundamental reality of the entire Maha movement. Joe, I'm going to give you one word to define Maha: curiosity. Are you earnestly curious? Now, remember, 80% of these questions people are asking are actually statements in disguise. So do you really want to know the answer to the tough questions that moms all across America are asking about the health of their kids and why we're managing sick kids in a sick care system that is dramatically changing their futures? And remember, unhealthy kids become unhealthy adults. So I will speak to not just the moral hazard of allowing kids to have the chronic illnesses that the Maha report describes, but I'm going to reinforce what Secretary Kennedy is saying. We want to go back and kick the tires and ask the fundamental questions that should have been asked back when Medicare and Medicaid were created 60 years ago. Are these really the right things to do for our kids? We've made it easy for kids to be sick in America. 3/4 can't even serve in the military. This is your patriotic duty to keep your family healthy, but we need to help you. And this report is pushing every agency to ask those tough questions. But as we do that, we truly want to have equipoise. You truly want to be open-minded. And if you hear things that are uncomfortable, inconvenient, you got to be courageous to share that truth. And you got to be compassionate as you do it, because people don't care what you know till they know that you care.